Well, in the rural areas of southwestern Ontario, the trends that are occurring in London have now spread into those rural areas. It took a little longer for fentanyl to become a huge issue, let's say in Elgin and Oxford counties, but now it is indeed there in those locations. I would say, having worked in the St. Thomas area for the last decade, that there is a somewhat better acceptance by other healthcare providers of the work that we try to accomplish in our Suboxone/methadone clinic in St. Thomas. There seems to be less stigma against the treatment for the opioid crisis rurally than in urban London, although that is now changing and improving in London. But our acceptance in that region has always been quite good from the start, actually, which was quite a pleasant thing. Because as I discuss with people, the brain bone is connected to the body bone. So what I think are really important questions are, whenever we have an intake on a patient in our Suboxone or methadone clinics, two question areas I always explore with people are, do you have any chronic pain? And describe that to me. And what is your mental health diagnosis, or do you have one? Sorry, there's a third question that's perhaps the most important of all. Do you have a personal trauma history? Is that trauma physical, verbal, psychological, or emotional? And we explore childhood, adolescence, growing up years, adulthood, and relationships. And probably 65 to 75% or more of people who self-identify as having opioid misuse disorder or opioid addiction actually have a significant mental health diagnosis. Similarly, 65 to 75% of people have a significant personal trauma history of some type. So if we take a Venn diagram, there's a lot of overlap between the two, but there are some people who fall into only one of those categories. And then there's the physical part too. We ask about past injuries and other chronic physical health conditions.